Hey, it's Brandon Lee here, and I'm just doing my trach suctioning checkoff video. I just want to show you the setup. I've got some oxygen right here and my pressure gauge right here. And then I've got my patient here with my makeshift trach. And without further ado, I'll get into it. So the first thing that we want to do is to determine the need for the procedure. Our client is having trouble breathing and has a buildup of secretions, so we need to suction those out. We've got a towel here for a mess in case that happens. But we also want to explain the procedure to the patient even if they are not alert or if they are comatose. And we want to tell them to be sure to let us know somehow by waving their hands or something if they're having trouble breathing so that we can stop the procedure. So first thing that we need to do is to provide privacy. So I'm going to close the door or pull the curtain. We want to use two patient identifiers to identify the patient. So can you tell me your name and date of birth, sir? Mr. Jones, July 15th, 1950. Okay, that's great. So the first thing that we're going to do is going to perform hand hygiene. So we got some hand sanitizer. Okay, so the first thing that we're going to do is open up this trach kit. And we're going to take out the little sterile box using only outside. So we're going to set that right there. And I've got some sterile water here. And over here we need to lip it. Pour some of that out and lip it. So now we're going to pour some into our container here. Okay, that should be enough. And then next we're going to put on our face shield. And we want to make sure that the patient is in a comfortable position during the procedure and make sure that the head of the bed is elevated and that the bed is at a good working height. Okay. Now we're going to get our sterile gloves out and we're going to put those on. Okay, and now we're going to take our suction kit, get that out of the bag, and with our oxygen, we want to make sure that it's at 10 liters, and with our pressure gauge, we want to make sure that it's at 120 to 150 millimeters of mercury, which is appropriate for this client. So the first thing that we want to do is to connect our suction. So I've got a cord here, connect our suction, and we're going to keep the suction catheter in our left hand, and we're going to keep the cord in our right hand to keep this sterile. So first thing we want to do is stick it into the water and see that the suction is working. So, okay, our suction is working just fine. So we're going to continue. Next thing that we want to do is we want to hyperoxygenate the client. So we're going to get a mask and put that on for 30 to 60 seconds. Okay, it's been about 45 seconds, so we'll take that off. So we want to begin by inserting our catheter into the patient, but we want to make sure not to be applying suction on the way down. So we're going to put that in quickly. And then on our way out, we're going to be applying intermittent suctioning, and we're going to be gently rotating. So we're going to Okay, and we don't want a pass to last longer than 15 seconds because that can really take the oxygen out of the lungs. So we want to put the oxygen mask back on for another 30 seconds to a minute. Okay, so it's been about 45 seconds. We'll take that off. And we want to keep this sterile in case we need to do a pass again. But we need to wait several minutes between each pass, probably about 5 minutes. And then we determine the need to see if we need to make another pass. But it sounds like our client is breathing better and doesn't have any more trouble breathing. So we'll unplug this from the suction, and then we can discard this. We'll take our gloves off. Okay, then we'll perform hand hygiene again. And then the next thing that we're going to do is make sure that the patient is comfortable. We're going to determine the effectiveness of the procedure. Oh, and I'll take this face mask off as well. So we're going to determine the effectiveness of the procedure, and we're going to look at the sputum that we've collected, and we're going to look at the characteristics of that, the color, the amount, and maybe odor. And we're just going to make sure that the patient is comfortable, and we'll suction them as needed. And that is my trach suctioning checkoff video. Thank you.